So we are going to talk about kids' neuropsychiatric health today. A very different topic. We've been talking about a lot of gut issues, but we want to bring the kids' health, right? So the topic today is pediatric acute onset neuropsychiatric syndrome. I mean, this is like seriously heavy stuff. So that's why we have Dr. Darin Ingels. He is a very well-known naturopathic doctor, and who is going to second, and we're going to talk about what exactly is PANS. That is a short form of what I said. Hello, Dr. Darin. How are you? Good morning.
Good morning, Amita. How are you?
I'm doing great. We have a very heavy topic. I was telling our viewers, this is like something I personally have never heard of. And this is Dr. Darin. He is one of the most respected naturopathic doctor in the country who has done amazing work in research and publications, international lectures, and he has over 30 years of experience. Anything else you'd like to add before we go into the topic, Dr. Darin?
No, this is, I'm glad we're talking about this. This is such a huge problem. And here in the United States, we've just seen this huge uptick of kids, experiencing this PANS syndrome. And parents are just left, scratching their heads like, what happened to my child? They have this perfectly normal, healthy, happy child. And then overnight, the kids fall apart and they become something completely different.
So what is the cause and symptom of PANS syndrome?
Yeah, so PANS, is pediatric acute onset neuropsychiatric syndrome, and it's literally a inflammation in the brain that's often triggered by some type of infectious agent. So unlike, when you get strep and you get strep throat, where you get a sore throat and swollen glands, in some cases it triggers this autoimmune event that actually affects your brain. So, typical PANS symptoms, and we see anxiety, we see OCD, we see tics, either vocal or motor. And sometimes we'll see, even beyond that, we'll see mood changes, behavior problems with concentration and focus, sleep disturbances. And other times we'll see physical effects. You can imagine if your brain's getting inflamed, it can affect anything downstream from that. And since your nervous system's tied into pretty much everything, sometimes kids get fast heart rate. Sometimes they start getting digestive issues. So I think, one of the key hallmarks is that when you see your child literally change overnight, and when I say overnight, it may not be 24 hours, but, within a matter of a few days, again, you go from having a normal, healthy child to something that's just very different. And the kids can't tell you what's wrong. They don't understand. You may or may not have seen any type of infection that preceded this event. So it can be really very frustrating for parents and even for doctors, sometimes to really pinpoint that this is what's going on.
Mm-hmm. So let me just understand, how do you diagnose it? Is there a specific test that you are going to do to understand that a kid has this neuropsychiatric syndrome?
Yeah, this has been a big problem. We don't really have any single test that helps identify what it is. And the problem is that there can be any number of different infectious agents that cause it. So Dr. Sue Suedo at the National Institute of Mental Health, she's the one who really coined this term, decades ago. And even she says, look, you can do testing. It might help pinpoint it. There's a Dr. Cunningham here in the States who's done research on this. And so she has a lab called Moleculara that it's called the Cunningham panel. And she's identified that there are very specific antibodies to brain proteins, things like dopamine 1 and dopamine 2 receptors, that a lot of these kids that have PANS do make these antibodies. So there is that test that's available. But beyond that, it really is a clinical diagnosis. Sometimes we'll do blood tests or stool tests to see if someone's had exposure to a new pathogen. But more often than not, we do these tests, nothing really shows up. We can't identify a specific thing. So often we have to kind of jump into treatment just based on the clinical symptoms.
So let me ask you this thing. Do you see kids who are coming in with this PANS syndrome? Are they also autistic, or do they also have ADD? Is there a correlation with these things that you have noticed?
Yeah, not specifically. I mean, I work with a lot of children with autism, and PANS is a common feature in that population, but I've had other neurotypic children that also develop PANS. So I don't think it specifically targets any one group in childhood. However, I think if you have a child that has some underlying immune issues, there may be a higher disposition towards PANS if you do have that exposure, but really it can affect, potentially any child.
Sure. So, all right. So let's just talk a little bit on the framework of treatment as a naturopathic doctor, right? So, how can you help these kids?
Sure. Well, we should understand the framework of the conventional approach, because in the conventional world, if the pediatrician identifies PANS, typically it's antibiotics. There's some sort of microbe that's causing the problem, so let's kill it. They'll use steroids, let's suppress the inflammation, or something like ibuprofen, or sometimes they'll use what's called intravenous immunoglobulin, which is literally getting an IV of pooled immunoglobulins to try and help support the immune system. And these all work to varying degrees. However, I don't think they're functionally addressing the underlying issue. If you think about something like strep, strep is a common pathogen or a common bug. A lot of people carry it in their bodies, and it doesn't necessarily cause disease. So from a naturopathic perspective, it's really about how do we modulate the immune system. I think we kind of get into this concept of germ theory versus terrain theory. Is the germ really the problem, or is it the terrain that's set up that allows the germ to become more problematic? So I think, most of us in naturopathic medicine really feel more about terrain theory, and that if we can help, get the gut healthy, get the immune system healthy, the way the body reacts to these normal bugs in our world is quite different. So it's really about, going back to these fundamental things, looking what the child's eating, looking at their gut health. Is there any history of allergy? Or is their immune system already tipped in the scales that they're already disposed towards having that autoimmune thing? So, we do a lot with, of course, working with their diet. We have a lot of herbs in our repertoire to help manage the infection. So yeah, to a certain degree, you do want to control that, because that's what's triggering
So
the immune system.
again,
But that's really
herbs. Diet and herbs is how you do it. How you even treat such an very complicated, I should say, that syndrome, right? Diet and herbs and in the end, that's the answer.
That's a huge part of it. And then beyond that, we've got some more advanced therapies, specifically types of immunotherapy, where we can help modulate the way the immune system's reacting to a specific microbe. So imagine your body's treating strep like an allergen instead of a pathogen. It engages a completely different part of the immune system. So we've been using a thing called low-dose immunotherapy in our practice as a way to help modulate the immune system against that specific bug. So it kind of falls almost in the line of homeopathy, where we actually give dead bug and we mix it with an enzyme and we administer it under the tongue. So it's very safe and easy for kids. But sometimes it can really help modulate the immune system the right way to kind of turn off that autoimmune reaction to whatever microbe is triggering the problem.
So it's really modulating the immune system using homeopathy and some of the diet, of course, we just talked about. And what are the common herbs? This is not a medical advice, of course, just the common herbs that are generally used.
Yeah, we have a lot of herbs that have antimicrobial effects. So we use a lot of cat's claw. We use a lot of berberine. We use a lot of mushroom extracts to help, modulate the immune system. So yeah, we're fortunate that we have so many different things. We use artemisia. We use hatunia. So, it really is just a function of finding. Yeah, I mean, that's the beauty of herbal medicine, is that we've got so many different herbs to choose from that we can really tailor it to each individual child to figure out what works best for them.
Sure. So in your opinion, let's say when the kid walks in with the PANS syndrome, how much time does it take for them to get well, or to kind of come back to some kind of a normalcy?
Yeah, it varies a lot. In some cases, it's a matter of days. In other cases, it's weeks. And in some cases, it's even months. It can be a very challenging problem to get to a point where kids are really back to their normal selves. And again, I think it really varies so much, again, on their immune response, how well they respond to therapy. It's not uncommon that sometimes we have to try a couple of 3 different, protocols to see which one fits the child best. And in some cases, we have kids that are really out of control. I mean, they're on the verge of getting admitted into the hospital or a psychiatric institute because they're just so out of control. And sometimes we do need things like steroids or ibuprofen just to help control that inflammation short term, just to get things in enough under control so that we can do some of these other therapies that might have better lasting effects.
So, all right, and is there any age group of the kids that you have observed this particular syndrome, like 3 to 5, 5 to 7, or is it like all across till a certain age group?
Yeah, I'd say the bulk of them are probably between the ages of 6 and 15.
6 to 15, so that's a wide range. That's a wide range, right?
It's a pretty wide range. Yeah, there is even an adult version of this. We always talk about it being in kids, but we do see some adults that experience this as well. It manifests a little bit differently. But in kids, yeah, it is a pretty wide range. I'd say the bulk of that probably falls within the ages of probably 6 and 10, though. It does tend to affect younger kids more than older children.
6 and 10. And then, and that's probably, you think, the way they develop it at the age of 6, because they're not now breastfeeding infants. Now they are probably exposed to sad diet or some of the other things. I mean, what do you think the root cause for this is, especially at the 6 to 15?
Well, I think it's cumulative toxicity. I think if we look around the world, our world just keeps getting more toxic. And kids now, we know from the research, are getting generational exposure. So it's not even what the kids themselves are being exposed to, it's what their parents and their grandparents got exposed to that gets passed down. So this cumulative exposure, I think, is affecting their immune system, it's affecting their hormones, and of course affecting their brain. So whether it's a leaky brain kind of situation, we don't really know, but, we know that leaky gut's a big problem. We suspect that leaky brain is part of what's allowing these things to pass through, that's triggering that inflammatory response. Yeah, why would the immune system, react that way to something that's a normal part of our world? I think it kind of comes to the root of all autoimmune conditions. Why does the immune system turn on things that are normal? And I think we could argue that, toxicity is at least a big contributing factor to that.
Sure. And toxicity is everywhere, in our food, in our everything that we do, environment, you name it, right?
Exactly.
Yes. Thank you so much. I think it's very informational session. This is something that people really don't understand, this particular topic. Anything else you'd like to add to this?
Well, I think it's just important for parents to recognize, if your children start to have these, unexpected changes that happen quickly, get them into a professional as soon as possible, because if it's one of these things that if you let it go, the further it gets along, just the harder it is to deal with. So definitely get, evaluation right away and get your child in the hands of the right person that can help, get the right treatment in place.
Sure. Thank you so much, Dr. Darin. To all the viewers, if there are any questions, I know this is a pretty heavy topic, but you can digest it a little bit and then ask us questions later on. But if you are a parent and you have kids and you see some disturbing behavior that's not normal, seek out professional help. And this video is an amazing topic for you to really understand the preview of what your child might be going through, if that's the case. With that, thank you so much, Dr. Darin, for being with us. Really appreciate you sharing this knowledge.
Great. Thank you, Amita.
Thank you. Bye-bye.